Good morning, my name is Denise. What's your name?
Caleb.
Caleb, hi. I'm going to do a physical assessment on you. I'm going to start by beginning with the skin. I'm going to have a look at your skin, and we're going to go sort of from the top to the bottom with that. So I'm going to begin with your upper extremities, and in looking at your face, your skin is clear. It has a pinkish tone to it. There's good moisture. It's warm to the touch, and the skin turgor is good with no tenting. The eyebrows are symmetrical and evenly distributed with hair. You have an even amount of hair distribution on your face. There is no thinning. Everything is even. In looking at your hair, you have a thick, full head of hair. There is no areas of balding. Your hair is clean. It is dry. It is not brittle. It is smooth. In palpating your head, there are no bumps. There are no lesions noted. And again, in separating the hair, there is no balding noted as well. Your neck is clear. It has the same pinkish hue as your face. Everything is even. There are a few macules on your forehead, but no lesions again anywhere else. No lesions on your neck. I'm just going to palpate here. Are the paranasal sinuses, is this tender at all in this area?
No.
Okay, great. In looking at your lower extremities, again, your skin has a pinkish hue. The skin is smooth, it's warm to the touch, there are no lesions. There are 3 small scratches on the right forearm. In looking at your hands are clear, no lesions. Fingernails are clean, well groomed. There are no spots, there are no vertical or horizontal lines. The capillary refill is good. The blood returns immediately after I compress down on the nail. And I just want you to put your fingernails together. Good. There is no clubbing noted on the fingernails, and I would do that with all of the nails as well. Okay, great. Your lower extremities, again, clear, no lesions noted, a small scratch on that left part of the interior knee. An even distribution of hair is noted. There is no edema in the hands, the arms, the legs, or the feet. And I'm not seeing any varicosities in the feet as well, or the legs. The toenails are clean. Again, there's no spots. They're well groomed. The capillary refill is good, immediate blood return. And no edema in the toes. No thickness noted, no yellow discoloration, no thickness discoloration of the fingernails as well. Okay, great. So that's the lower extremities. Now I'm going to go back up to your face. I'm going to focus on the cranial nerves, particularly cranial nerve number 5, which is trigeminal. And that has to do with a lot of your facial movements. So I just want you, first of all, I'm going to check your TMJ, the temporomandibular joint. If you could just open your mouth, good, and close it, and open it again. Good, and so it's symmetrical. There is no popping or clicking noted. When you open your mouth, okay, leave it open. If you can move your mouth lateral, good. Bite down and do a bit of chomping for me. Good, great. So all of those are intact. And then I just want to make sure that there is proper sensation. I want you to close your eyes, and you're going to tell me whether what you're feeling on your face is soft or if it's sharper, okay?
Soft. 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 Sharp. Sharper. Sharp. Soft. Sharp.
Okay, great. And then I want you to frown. Now, what we're doing now has to do with the cranial nerve number 7, and that's the facial nerve. And so I want you to frown for me. Good. I want you to smile. I want you to lift your eyebrows. I want you to close your eyes and open them again. Good. And again, I just want you to clench your teeth. Good. And any pain felt at all through here?
Nope.
Okay, great. Okay, great. So that's the face, the scalp, the skin of the lower and the upper extremities that we have discussed and I have assessed. Caleb, now we're going to do the physical assessment, the eye portion of the physical assessment. I'm going to observe your eyes. I'm also going to look into them and just give you a few tests. At any point, if you're uncomfortable, let me know, okay? So we're going to start with cranial nerve number 2, which is your optic nerve. And we have already done the Snellen and the Rosenbaum, which has to do with the Snellen for distant and the Rosenbaum for nearsighted, and so we've done those 2 tests and you passed them. You do not wear glasses, correct?
Yep.
So that was done uncorrected. The third test I want to do on you is for peripheral vision, and I want you to cover your right eye, okay? And I want you to tell me when you see this pen, okay? So I'm going to start over here.
I see it. Yep. Right there.
Good.
Right there.
Okay, keep that eye covered.
Right there. There. Right there.
Good. And we would do this bilaterally on either eye. You can remove your hand, so that's great. The other thing I'm going to test you for is your extraocular muscles, and that has to do with 3, 4, and 6. The trochlear, the oculomotor, the trigeminal, and the abducens. And so the first test I'm going to do for you is just a gaze, the 6 points of gaze. And so I just want you to follow my pen light. Good. And then we're going to start here again and follow it again. Great. And I want you to look at the back wall, okay? And keep your focus there. And then I want you to look at your nose where this pen light is. Good. Okay. And pupils are both consensual and reactive. They're equal. And then we'll do the twinkle test. So I just want you to look straight ahead, okay? And I'm just going to have a look in your eye. Good. And continue to look straight ahead. Great. Okay. And then the final test, just in testing your extraocular muscles, will be the cover test. So I want you to take this card, and I just want you to put it in front of one of your eyes. Good. And I want you to focus on an object on that side of the room. Good. Now remove the card. Okay, excellent. And both eyes are equal. The pupils are both consensual and they're looking the same way. Okay, great. And we would do that bilaterally on the other eye as well. Okay, so those are those tests. Now I just want to actually have a look at your eyes. In looking at your eyes, they are symmetrical. If you close your eyes for a minute, I'm just going to palpate the lacrimal duct and sac. Is anything tender?
Nope.
No soreness. Okay. And in looking at your pupils, they are equal, they are round, they are reactive when you were looking at a far distance as well as close as well. There are no lesions. There's no exudate coming from the eyes. Your sclera is white. Your irises are a bluish gray. Your pupils are round and equal. Your eyelashes are full and thick. Your eyebrows are full and thick. Okay, and so that is just in looking and inspecting your eyes. And then the final test, what I'll do is actually be looking in your eye. Caleb, I'm just going to grab my ophthalmoscope just to do that test that I'm talking about, looking in your eye. And again, you were saying you're not having any pain or problems with your vision?
Nope.
Okay. I'm just going to place my hand on your shoulder. Actually, what I would do first of all is I would stand about this length, or this distance between you to check red reflex, and the lights would be turned off in the room, which I was able to see with you, your red reflex in both eyes. Now I'm just going to have a look in your right eye. I'm just going to place my hand on your shoulder if you don't mind. I'm going to look straight into your eye and just keep looking straight ahead and just relax. Okay, great. And then looking in your eye, I could see the optic disc. The fundus of it is a yellowish orange depression. It's about 1.5 millimeters, so I was able to see that. Beyond that, there are a whole bunch of vessels that lead to the fovea, the macula, and that's a darker circle. And again, there's more vision in that area. That's where the central vision is. And then beyond that, in that macula is a little white dot. It's called the fovea centralis, and that's where even more vision is concentrated. A lot of the central vision is there. And so all of that was visualized. Your vessels look healthy, they're bright. There's no retinal hemorrhages noted. The AV nodes were seen as well, 3 to 5. The ratio, there were no hemorrhages there as well. No exudate coming out of the eye. There was no AV crossing. So everything appears healthy in your eye. Caleb, now we're going to look at the ear. We've already done the eye. I'm going to inspect and palpate your ears, and then I'm actually going to look inside the ear and then conclude with a couple of tests, okay? If at any point, I'm just going to get my otoscope, if at any point you are uncomfortable, please let me know. Okay, so in looking at the ears, they are symmetrical, both of them. They are in the same position. They have the same skin color tone as the rest of your face and your neck. There is no apparent exudate discharge coming from the ears. There is no redness or inflammation. When I press here on the tragus, is there any discomfort?
No.
No. Any tenderness in the mastoid area behind?
No.
When I pull on your ear, is there any tenderness or pain?
No.
Have you had any tenderness, pain, or any hearing issues?
No.
No. Okay, that's great. I am now going to look inside the ear. Just going to pull back on your pinna of the ear. Great. And in looking in the ear, the external meatus and your canal is not red. There's no inflammation. I was able to view the tympanic membrane, which is a clear grayish translucent disc. It looked beautiful. There was no inflammation or redness seen there. At the 5 o'clock position, I could see the cone of reflection. That was noted as well. And the umbus, the pars tensa, the pars flaccida, all of that was viewed as well. So everything looks great with the ears. So I'm just going to put the otoscope down. And then I'm going to try a couple of tests with you. I'm going to say something and I just want you to repeat it. It's just a whisper test, okay?
You said, Caleb, how's the weather today?
Perfect, that's great. And I would do that on the other side as well. The last 2 tests I'm going to do, the first one's called the Weber test. I'm going to smack the tuning fork on my hand, and then I'm going to put it on your head, and I want you to tell me if you can hear the sound equally with both ears, or if there's one side more than the other that you hear the sound. And then tell me when it stops for you, okay?
It's equal in both ears, and I can't hear anymore.
Okay, great. The next test will be the Rhine test, and so I'm going to do the same thing with the tuning fork. This time I'm going to place it on the back of your ear, just on the bone area, and you tell me when you stop hearing that sound, and then I'm going to bring the tuning fork forward, so it's just in the air, and you tell me when that sound stops in that position, okay? So we'll start with the back of the ear.
I can't hear anymore. And I can't hear anymore.
Okay, great. And so that's super as well. You should be able to hear air conduction twice as long as you do the bone conduction. And with the 2-to-1, you pass that. So that was done well. Okay, and so that concludes our ear portion of this test. And then we'll continue on, and I will now start with the nose and the mouth. I'm going to have a look at your nose now. Let me just grab my light. So in looking at your nose, it has the right size and shape that's appropriate for your face. It's symmetrical. The tones of your skin are the same as your face. The nares are both the same size. If I palpate here, is there any pain?
No.
Good. Any pain going down the nose?
No.
Okay, and there's no noticeable discharge or inflammation. There is no redness. Caleb, I'm just going to have a look up into your nose, okay? If you just tilt your head up. And both nares are patent. The septum is midline. There is no deviation. There is no perforation. There's no inflammation seen inside. And the inferior turbinates are seen, but the superior are not. Okay, and you can bring your nose down, that's great. I'm going to get you just to push on one side of your nose and then breathe through the other. Good, and then do it with the other side. Great, and both nares are patent. I'm going to now test the cranial nerve number 1, which is your olfactory nerve, and I'm going to get you to close your eyes, and I'm going to get you to smell 2 scents, and I want you to tell me what they smell like, okay? So if you go ahead and close your eyes, this is the first scent. Just smell that. What does that smell like?
Cinnamon.
Yes, good. Okay, and then the next scent?
Onions.
Yes, okay, good, and you can open your eyes. Okay, that's great. And now we're going to, I'm going to assess and inspect your mouth, okay? So in looking at your mouth, again, it's symmetrical. Your lips are a pink tone. They are not chapped. There are no lesions on them. I'm just going to get you to open your mouth. Your gums are pink. And your buccal mucosa is pinkish as well and moist. If you could stick out your tongue. Your tongue is moist. Good, and there are no lesions, no bumps noted. Now, I had my gloves on previously, and I was looking in the mouth, and I was able to count your teeth, and you have 30. There was one wisdom tooth that is starting to come through on your right side. Just a minimal amount is noticeable. Both your inferior frenulum and then the sublingual was noted and seen and intact. I was able to see the Wharton as well as Stenson and the buds, and I was able to feel them and palpate them as well. Can you just stick out your tongue and say ah?
Ah.
Good. In doing that, the uvula bops up and down, and that's appropriate as well. Your mucosa in the back is very moist, well hydrated. There are no lesions noted at the back, and I was able to feel the hard palate and the soft palate, which ran in together. Your teeth are white. There are no yellowish parts to your teeth, no chips, everything is intact, and there are no foul odors coming from your mouth. In sticking out your tongue, you're using cranial nerve number 12. That is the hypoglossal, that has all the movements of the tongue. And then the cranial nerves number 9 and 10, they're the glossopharyngeal and the vagus. And those have to do with your swallowing, which you're able to do, the gag reflex, as well as your speech. So all of that is intact and functioning normally. Caleb, I'm now going to assess your neck. We've done your nose and your mouth. We're just working our way down. In looking at your neck, again, there's symmetry. Your head is held erect. There's no visible tremors. When you swallow, there are no lesions or distensions, not lesions, but distension that I see in the trachea area. Is there any pain with swallowing for you?
No.
No, okay. In looking at your neck, it's the same color, same pinkish tone as your face. There are no visible lesions or sores anywhere on the neck. When I press anywhere around here, is there tenderness or pain?
No.
Okay, and I'm just pressing on the muscles. I'm pressing on the vertebral spinal column. If you could just bend forward a tiny little bit. Is there any pain through here?
No.
Okay, and any pain through here?
Nope.
Good. And sit back. Any pain through here?
No.
Okay, great. I'm going to also feel your nose. So there are no visible, there's no inflammation of the lymph nodes. I'm going to do the post-auricle as well as the pre-auricle. And I'm just working my way down, just above the subclavian, along the branches. And then the mandibular. Any pain when I do that?
No.
Okay, great. I just want to test and look at the range of motion of your neck. If you can just put your head forward for me, and then I want you to extend it backwards. And I want you to go lateral and touch each shoulder. Good, and the other one? Great. And these have to do with cranial nerve number 11, the accessory, the spinal accessory. And so I'm also going to ask you just to shrug your shoulders and then do it again with me, causing some resistance. Good, okay. And moving the head also has to do with that, so we covered that. I'm finally just going to have a feel. I'm going to palpate the trachea. So I would go to the sternal notch and move myself up and feel the cartilage that feels like a C. Now earlier we had gotten you to drink some water, and I was able to feel that the trachea there was no nodules or distension of the trachea when you did that. I'm just going to have a listen to the trachea as well. Good, and there's no bruise. I'm also going to feel, when I look at the carotid, I can see a bit of a pulse. There is no distension of the carotid or jugular vein, and I'm just going to have a feel at the carotid pulse. And then I'm also going to have a listen for that as well. And again, there's no bruise that I hear. When you were drinking the water earlier, I was also able to feel the cartilage of the trachea move, and behind where the thyroid is, it's very difficult to palpate, but there was no distension in that area where the thyroid is. I'm also going to have a listen in that area as well. Good, and there are no bruises. Okay. Caleb, now I'm going to assess the thorax. So I'm going to have a look at your chest. I'm going to just watch your respirations. I'm going to listen also to your breath sounds and just do a couple of other things just in evaluating your diaphragm I'm gonna start by just asking you to take off your shirt for this. Okay, great. And in looking at your chest has symmetry, your clavicles are even, your neck is midline, the sternum is midline. There are no visible lesions, bulges. There are some macules on the chest, and there is some normal male pattern hair distribution. I'm just going to have a feel for a little bit. Is there any tenderness when I do this?
No.
Okay. And I'm just going to go along the front and the back. And no tenderness at all?
No.
Good. And no palpable mass is noted. Okay, great. Your respirations are even and they're smooth. I am not seeing any strain in the way you breathe. There is no shrugging. I am going to have just a listen to your lungs in a few minutes. I just want to, I'm going to go into the back area, and I'm just going to ask you if you can lean forward. Great. And I'm just going to percuss the lower bilateral. Good. And I'll just ask you to lean forward a little bit more. Great. I'm going to just get down by the 10th rib and just feel the expansion of your breathing. Can you also take a deep breath in for me? Great. And out. Okay, good. Okay, great. And again, just feeling the intercostal muscles. Okay. Caleb, I'm going to do something called diaphragmatic excursion. And what it does is it gives me an idea of where the diaphragm is when you're breathing at certain times. So I'm just going to get my pen and my measuring tape. I want you to lean forward. I'm just going to do this on one side. This would be done back bilaterally. Okay. Okay, take a deep breath in and hold it. Okay. Now I want you to take a deep breath in, and this time when you exhale, hold it. Good, and I'm just going to measure this. And great, it's 3 centimeters, which is normal. 3 to 5 is the normal expansion, or the normal measurement of your diaphragm. Okay, that's great. Now, Caleb, I'm just going to feel the vibration of your voice, and I want you to say 99 for me, and just continue to say 99 when I tell you, okay? Okay?
Okay. 99. 99. 99. 99.
Good. Again?
99. 99. 99. 99. 99.
Good. That is for tactile phrenitis, and so the vibrations were heard evenly when you were saying 99. Okay, that's great. I am now going to listen to your bilateral breath sounds. Okay, I'm going to start in the back. And you can just breathe normally. Great. And if you can just put your hands up over your head and rest your hands on your head for me. Just leaning forward a slight bit. Good. Okay, and then you can rest your hands down by your side. Okay, and your breath sounds are clear bilaterally. There's no adventitious breath sounds heard. Any pain when you take deep breaths in or with your breathing? Okay, and your respiration rate is about 18, so that's great. I'm going to move you to a different room now, and I'm going to get you to lie down. I'm going to assess your cardiovascular part of your chest, and then I'm going to assess your abdomen as well, and I'll do some reflexes on you, and we'll just do a couple of other exercises just in showing your range of motion, okay? Okay, Caleb, we're in the other room now. I am going to just do the cardiovascular assessment on you, and then we'll move you onto into a lying down position so I can do your abdomen and do some musculoskeletal range of motion assessment on you. So in looking at your chest, there are no apparent heaves or thrusts. There's not any palpations or any notable pulses that I can see. In feeling, palpating down by the apical. The PMI is palpable. It's just a very soft, steady beat. Okay, good. I can see a slight pulse where the carotid is as well. I am just going to have a listen to the heart. I'm going to start down. I'm going to just move your necklace back. I am going to start down by the PMI where the apical is. And down here, S1 is greater than S2 in terms of the sound. Good, and the heart rate is steady and regular. And that's down at the 5th intercostal space. And then up at the 4th intercostal space. Good. Again, S1 is greater than S2. And that's the tricuspid. And then the 3rd left intercostal space is Erb's point, and this is where S1 is equal to S2. And then we move up to the 2nd right intercostal space, which is the aortic. And now S2 is greater than S1. And then over to the aortic area, S2 is greater than S1. Okay, and no murmurs were felt in palpating the chest. I'm going to have a quick listen with the bell of my stethoscope just to the carotid. Okay, and no bruits. I'm going to have a listen now to your pulse in different areas. So we'll start with the temporal. Good, and that's steady. There's no bounding and no threading. The carotid. The brachial. The radial. The popliteal. the posterior tibial. On the dorsi radial. Okay, great. I also wanted to mention with your chest that the AP versus transverse is 2 to 1 in terms of the diameter. Okay. Now what I'm going to do is I'm going to move you to the bed and we're going to do an assessment on the abdomen and also just the lower part of your legs and your hips in terms of your range of motion. Okay, so if you want to just lower it a little bit, great. In looking at your abdomen, it's clear. There are no lesions. There is no bulging or herniation noted, especially around the umbilicus. Is there any tenderness around the umbilicus?
No.
The umbilicus is inverted. There are no hernias, as I said, that were noticeable. No peristalsis. It's negative for peristalsis. It's positive for pulse. Again, there's even respirations noted and movement with the abdomen. There's an even distribution of male hair. There you do have a scar on the right hip, on the lateral side of your waist there. Okay. And I'm just going to have a feel. Is there any tenderness?
No.
Okay. Good. And I just want to have a listen to your bowel sounds. Good, and bowel sounds are heard in all 4 quadrants. I'm also going to listen, just looking at, listening, for the different arteries, the renal, the femoral, and the iliac. And no friction or bruise heard. I'm going to have a listen to the liver, along with the spleen. Good, and again, no friction rubs heard. And now I'm just going to tap on them as well. And dullness noted over the liver area where it should be. I'm going to measure your liver in a minute. And the spleen is wrapped up into the under the left intercostal space. So there are sounds of tympany along with dullness, and that is normal because we're not able to palpate the spleen. We would be able to palpate the spleen if it wasn't enlarged, but we can't. So I've listened to both of them. I'm now going to measure the liver, and then feel the kidneys as well. Just going to get my pen. Okay. So 9 centimeters, so that's the normal size of a liver. Caleb, I'm just going to also listen to your abdomen. And there is tympany heard and dullness over the bladder. Okay. I'm also going to feel your liver now. So you let me do all the work. I'm just going to put my hand under your side. I want you to take a deep breath in and now cough. Great. And so I can feel the border of the liver. It's soft. There is no sharpness to it. And no mass is palpable. Okay. I'm also going to feel the kidneys, which are retroperitoneal. Any tenderness when I do that?
No.
Okay. And on this side? Okay, great. Okay, so we are now going to move to the musculoskeletal part of the assessment, and I'm going to have a look at your hips and your legs at this point since I have you lying down, and we're going to assess your range of motion, okay? Kayla, we're going to start with the hips. I want you to lift your leg up. That's flexion, good, and down, extension. I want you to do it while I put some resistance on there. Good, and down. Great. Now I want you to bring your knee up to touch your chest. Good, that's flexion of the knee and then extension. When we stand up, when you stand up, I'll get you to do hyperextension, and we can, you can do that for me. We would do this bilaterally. Now I want you to cross your leg like a man. So that's external rotation, and then I want you to bring your knee in towards your other knee. Yeah, and that's internal rotation. Great. Now with the feet, I want you to point your feet down towards the floor. So that's plantar flexion, and I want you to bring it up, and that's dorsiflexion. Do it with me giving you some resistance. Good, and then this way. Good. I'm going to hold your leg up, and I want you to rotate your ankle. Good, and I want you to point your toe towards that way. That's inversion, and then the other way is eversion. Good. Okay, great. I think we've demonstrated all of that and your hip strength. Any pain while you were doing that?
Nope.
Okay, great. I'm going to get you to stand up. And at this point, you can put your shirt back on, and we can just go back over by the chair. I'll just move this out a little bit. I want you to take your leg and push it out towards the door. We're going to demonstrate your hip and hyperflexion. So push it this way. Good. And that's hyperflexion. So we had the flexion, we had extension, and then hyperextension. Sorry, I said hyperflexion. It's hyperextension. Okay, good. And now I want you to rotate your hips. Good. Okay, and I want you to bend laterally on both sides. Okay, good. So good range of motion there. Okay, let's go from the top. I want you to do some neck range of motion tests. So you're going to put your head forward, flexion, and then back, extension, and then hyperextension. Good. And then laterally. Good. And any pain or discomfort doing that?
No.
Okay. I'm going to push on your cheek. You push against mine, my hand. Good. And this way. And then walk towards me and push. Good. And that's good resistance there. Okay. Caleb, I'm just going to, while we're finished the neck now and the shoulders, I'm just going to feel your joints. And I want you just to tell me if there's any pain or discomfort. None?
Nope.
Okay. And there's good alignment, good symmetry with your bones. There is nothing that looks out of place, or all of the joints look like they are aligned as well. We'll move to the shoulders, and so we're just going to do some rotation of the shoulders. If you can just do this. Good. And then we're going to just do the biceps. If you could just... Yeah, good. Now I'm going to give you a bit of resistance. This is just flexion and then extension. Good. And flex them again. And then extension with resistance. Good. Okay. I want you to take your hands and I just want you to rotate your wrists. Good. I want you to do ulnar and radial deviation. Good. And any pain there?
Nope.
Okay, good. And we don't usually give resistance with that. I do want you to spread your fingers. Good. And then me giving you resistance, I want you to close your fingers. Good. Okay. Great. And then we'll move to the knees. So flexing your knee up and then down is extension. Good. Okay, and I think we have hit everything. I'm going to now look at your back, and what I want you to do is just to bend over all the way. I'm just going to make sure that all of your vertebral spaces are in place and aligned, which they are. There's no apparent scoliosis, nothing deviating to the right or the left. Any pain when I do this?
No.
Okay, good. Okay, great. You can stand up, and then what we'll do is we'll start the neurological assessment. Caleb, I want to observe your gait, the way you walk. I'm just going to move this chair for a minute. So start at this wall, and with your feet to heel, just walk up to about this point for me. Head, can you do your head straight ahead? Good. And then just turn around and walk normally back to the wall. Great. We're going to do something called the Romberg test. I'm going to get you to stand here. Good. And just with your feet apart like that, I just want you to look ahead. Now close your eyes. Good. And I'm just going to give you a little bit of a... Good. And so that was negative. There was no swaying. You handled that very well. I'm going to get you to sit in the chair. I'm going to do a couple of tests just for sensory. The first one's going to be the 2-point test. And so I'm going to touch either your arm or your leg. I want you to tell me which arm it is, which leg it is, and if it's 2 points that I'm touching with or 1 point. Okay? So close your eyes.
Left leg, 2 points. Right arm, 2 points. Right leg, 1 point. Left arm, 2 points.
Great. Okay, and you can open your eyes. The next one I'm going to do is dull and soft and sharp. And you're going to tell me, or we can just call this dull. You're going to tell me if it's a dull sensation and which part of your body it is, arms or legs, or if it's a sharp. Okay? So again, you can close your eyes.
Dull on the right leg. Sharp on the right arm. Dull on the left leg. Sharp on left arm. Dull on left arm.
Okay, great. And you can... Stereognosis is going to be the next test. So I want you to close your eyes. I'm going to place something in your hand, and then I want you to tell me what it is. Okay?
Okay. The coin?
Yes. That's great. And you can open your eyes. The next thing I'm going to do is I'm going to take your hand and I'm going to draw a letter on there, or sorry, a number, and I want you to tell me what that number is, okay?
Okay. Seven.
7 is correct. And that is the test for graphesthesia. And something I hadn't done earlier when you were standing, just a nose to finger test. If you could just do this. Great. And then standing up, I want you to do, good. Okay. Now we're going to do something called the vibration test. I'm going to get you to sit back down. Sorry, I keep getting you to pop up and down. I'm going to hit the tuning fork again, and you tell me when you feel it vibrating on you and when it stops. Okay? You can even tell me whereabouts it is on your body. Okay?
Okay.
You can close your eyes.
Feel it on my left foot. And I can't feel anymore.
Okay? Good. The last test is just going to be a position test. I'm going to put something on a part of your body and you tell me which part of your body it is, okay?
Okay. My left arm. My right leg. My chest. My left knee. My right arm.
Okay? One more.
My left elbow.
Okay, good. That's great. And now I'm just going to do some reflexes on you. I'm going to do your tricep. Good. I would do that bilaterally. I'm going to do your bicep. The brachioradial, which is up from the pinky. Good. I'll do this one too. I'm going to do your patellar and just relax. And just look over on that side of the room. Good. And relax this knee. And just looking over at the other side. So you're a +1 there. I'm going to do, let's do the ankle jerk. So I'm just going to get you, come over here. I want you to kneel on this chest. With your ankles dangling over it.
Both things?
Yeah. That's great. Just move yourself in a little bit more. Good. Okay, and just relax your feet. Good, yep, and that one's about a +2, the other one's a +1. Okay. And we've concluded everything. You can stand up, Caleb. Thank you so much for letting me do a physical assessment on you today.
My pleasure.